Hello, this is a recording for HIT 154, Introduction to Medical Science, on the environment and disease, and on diet and disease. This is a section I feel very strongly about because I feel that the relationships between diet and disease and nutrition and disease are extremely important and perhaps not emphasized enough in some of our traditional studies. I can't possibly cover everything. This is your instructor, Alice Shapiro, but I will get some of the highlights and hope that you will delve a little bit further into this topic. There are a number of other topics, sites for you to go to and so forth on our Moodle page for this unit. All right, here we go. First of all, my objectives in this unit are to expose you, the student, to recent information concerning diet and disease and the environment and disease, and to help you form an opinion based upon the latest research regarding these topics. All right, this following slides through number 10 were provided by the National Alliance for Nutrition and Activity, and they are available on the CSPI website, the Center for Science and the Public Interest. I encourage you to go there. These statistics, I couldn't get more recent statistics, but these statistics are from 2003, and believe me, things have not improved in terms of our nation and our health related to poor diet. So here we go. Here's the summary. I'm not going to read it to you. This is available to you on the PowerPoint, both this one that I'm narrating and excuse me, and in non-narrated format as well. Notice this, though: 2/3 of premature death in the U.S. are due to poor nutrition or physical inactivity or tobacco use or a combination. There are limited programs available that promote healthy eating and physical activity. In other words, prevention is not always emphasized. Obesity is one of the greatest public health challenges of our time. 65% of American adults are affected by obesity, and a growing number of children as well. And children are developing adult diseases such as cardiac issues and type 2 diabetes. Here is a diagram showing you more about unhealthful eating and physical inactivity, and that it causes 1/3, that's over 33% of premature deaths in this country. Highlighted in red are the physical activity and diet data. Notice this is the leading cause. Diet and physical inactivity is the leading cause in our country of premature death. Then leading causes of death, as we've talked about earlier, are heart disease, cancer, and stroke, the three top ones, all of them related to diet and physical inactivity. Diabetes also related to diet and physical inactivity, that is type 2 diabetes. Chronic liver disease such as cirrhosis and high blood pressure, also diet and inactivity. Are you convinced yet? Obesity is one of the greatest health challenges of our times. And notice the rise in young people who are obese from the earlier 60s to actually 10 years ago. And this graph keeps going up. Please go back and read the quotes on this page and take a look at this information. Diabetes is actually the twin epidemic to obesity. Obesity leads to syndrome X, which does lead to type 2 obesity. Notice some of the healthcare costs are also shown here, and although these data are from over 10 years ago, this line is ever growing. There is a very, very strong relationship between obesity and diabetes. All right, here are more graphs. Please take a look at these. The seriously overweight and obese people in our country as of 10 years ago, about 10 years ago, was over or close to 130 million people. And out of these people, here are the high blood pressure statistics, diabetes, coronary heart disease, and so forth. Notice the leading cause of permanent premature disability in the U.S. labor force is coronary heart disease, very strongly correlated with poor diet and lack of activity. Here are some data for healthcare costs. I'm not asking you to memorize these. I want you to take a look at them. I feel these are extremely important to anybody, really to anybody, and particularly people going into a health-related field, whether you are going to be working directly with patients or whether you are going to be doing medical transcription. You need to know these data. All right, sick care versus health care. Notice the factors that influence gain in life expectancy were public health and preventive measures over 25 years. These helped increase life expectancy. Curative medicines helped increase life expectancy by about 5 years. Preventive measures helped increase life expectancy by 25 years. And notice the amount of money spent on health care, which means the curative medical expenses far outweighed the prevention. I am not saying it's not important to cure disease when it occurs. What I am saying, and what these data show, is that it's equally important, perhaps even more important, to spend money on prevention, to spend money on educating the public, to spend money on providing healthful foods. I don't want to get on my soapbox or on my lettuce box, but these are the cold hard facts. They really are. All right, we are seeing an increase of adult diseases in children. Look at this. Only 2% of children eat a really healthful diet. In other words, including enough whole grains, enough fiber, enough fruits and vegetables, and a lower amount of fat. 3 out of 4 high school students do not eat 5 or more servings of fruits and vegetables, as is recommended. 3/4 of our children, over 75%, consume more saturated fat. 25% of children ages 5 to 10 years have high cholesterol. This is incredible. We need to do something. We need to take action. All right, so this gives credit to the following slides. I appreciate I was at a conference in which I was freely allowed to use these. This information is so important to get out that anybody who deals with these topics is happy to share. Persistent organic pollutants. This tells you a little bit about them. They are toxic. You know what that means. They bioaccumulate. We get higher concentrations of these organic pesticides. What I mean by organic is that they persist in the body, persist in organic tissue. The higher up the food chain that you go, the more concentrated these toxins are. We are quite high on the food chain. If you eat meat, animal products, you are higher on the food chain than people who consume more vegetables and less meat. All right, endocrine disruptors. I have some information. Most of these are pesticides. PCBs are used in coolants and flame retardants. PCBs are also found in children's pajamas. There has been some information in the news and more recent publications about the dangers of the flame retardants. Keep your children away from flames, but do not buy them flame retardant clothing. These are toxic. All right, it also could be the possible cause of decreasing male sperm counts, being exposed to these organic pollutants. The cases of hypospadias, which is where the opening of the urethra is beneath the penis, on the underside of the penis in males, rather than at the tip where it belongs. They have increased. Endocrine disruptors, which many of the pesticides are endocrine disruptors. That means they interfere with our hormonal system, can lead to obesity, insulin resistance, diabetes, PCOS, which is polycystic ovarian syndrome, endometriosis, uterine fibroids, and premature ovarian failure. The male and female reproductive tracts are both affected. Impaired fertility, low birth weight, multiple cancers, thyroid disease, and hormone-related diseases are on the rise, like breast and prostate cancers, thyroid disease. You can read this. Some consequences of hormones in the food supply, such as growth hormone in milk. Fortunately, throughout most of Oregon, the bovine growth hormone has been eliminated from dairy products through a lot of hard work by people who are concerned about the environment and what we are putting in our food supply. But read about what can happen. And since these chemicals persist, even if we remove the chemicals, it is likely that some of these conditions will persist. What can you do? Cosmetics also contain a number of environmental toxins. Please go to the Environmental Working Group's website for databases of toxins in cosmetics. I believe I put their website on this week for you. If not, it is www.ewg.org, or just look for Environmental Working Group. There is wonderful information there. You need to reduce your exposure as much as possible. Read the fine print when you buy products. Especially October is called Breast Cancer Awareness Month. A lot of manufacturers take advantage and put pink labels and pink ribbons and pink whatevers on their products to encourage people to buy them. Read the labels. Go to the Environmental Working Group. Make sure you know what the toxins are, potential toxins are that can be in these products. Take a list with you and avoid buying them. If there are any fragrances, we don't know what is in fragrances, but likely dioxins, which allow it to permeate the air. Some of these things which make perfumes, let's say, disperse, are toxic. Avoid milk products from bovine growth hormone treated cattle. Whenever possible, eat organic and particularly free-range beef if you are not a vegetarian. Do not microwave food in plastic containers. That will release some of the PCBs and other BPAs. Do not freeze a plastic water bottle. Don't freeze water in a plastic water bottle. Some people do that before they go hiking or picnicking. That can also release some of the toxic chemicals. Notice, etc. Spread the word. For further information, here are some websites for you, as well as some others I have given you and are on our Moodle site this week, and some more. All right, I hope this has given you a little overview. The best way to avoid contamination is to not use products that are contaminated or contain potentially harmful chemicals, to eat right, and to exercise. Take a walk. Right now, after you finish studying, take a walk, take a jog, jump rope, ride your bicycle. Whatever it is that makes you feel exercised and even calmer is what you should do. All right, so this has sort of been my, not really soapbox, but this is a very important topic. As you can see, I feel very strongly about it, and I don't feel that enough information gets to the average typical student in the typical class. Thank you for your time. Enjoy studying about this because it will lead you to make better choices. I will chat with you again soon.